My name is Ogbuta, and today I'm going to be talking about the mumps disease.
Wait, can you come a little closer to the mic? Try it again.
My name is Ogbuta, and today I'm going to be talking about the mumps disease. History of mumps. Keratitis and orchitis were described as some of the symptoms of the mumps by Greek physician and philosopher Hippocrates in the 5th BCE. Then in 1934, Dr. Johnson and Dr. Goodpasture were the ones who found that the virus could be transmitted through viral etiology. No one knows where the mumps virus originated, although some theorize it was passed along by bats. Dr. Ernst William Goodpasture. Goodpasture was an American pathologist and physician. He was born in Clarksville, Tennessee on October 17, 1896, and he was a Johns Hopkins Medical School graduate with an MD degree. He died from a sudden heart attack on September 20, 1960. Goodpasture received several scientific awards during his career, including the H. Ricketts Award, the Cobra Medal, and the Cabo Medal of the National Academy of Science. Cases and outbreaks. Mumps is no longer very common in the U.S., but before the U.S. mumps vaccination program started in 1967, about 186,000 cases were reported each year. Since the pre-vaccine era, there was a more than 99% decrease in mumps cases in the U.S. And the mumps outbreaks only can occur at any time of the year, but most often occur during spring and winter. A major factor contributing to the outbreaks is being in a crowded environment, such as attending the same class, playing on the same sports team, and living in a dormitory with someone infected with mumps. Demographics. In 1964, 212 cases occurred in the U.S. In 1989, mumps cases have declined from 5,712 cases to a total of 258 cases in 2004. The largest percentage of cases occur among people ages 5 to 17 years, and 71% of the patients are male. The objective of my experiment is to investigate the causes of outbreaks, to understand the pathogenesis of the mumps virus, and to see which animal model works best for the study of mumps pathogenesis. Procedure. First, viral cells were grown, and then they were cultured at 37 degrees Celsius with 5% carbon dioxide and passage the day before infection. The viruses were harvested at 4 or 5 days post-infection and stored at negative 80 degrees Celsius. Then the viral proteins of the mumps infection were prepared for the injection of the 3 animal models, which were the mice, ferrets, and rhesus monkeys. Results. The mice did not display any obvious signs of illness, such as weight loss, fever, or behavioral change. Ferrets. None of the ferrets developed fever, however, starting from day 6 post-infection, the ferrets did show a general increase of body temperature. None of the infected monkeys showed any fever or neurologic signs during the experimental period. Rhesus monkeys represent the best animal model for the study of the mumps virus pathogenesis. What is the mumps virus? The mumps virus is a causative agent of the mumps. The virus is a roughly spherical particle made of concentric layers of fatty lipids, large protein molecules, and nucleic acid. The virus is highly contagious and has a rapid spread among members living in close quarters. The mumps virus also belongs to the genus Rubiovirus of the Paramyxovirus family. Causes of mumps. Mumps is caused when the mumps virus enters the body through the airways and passes the body through the bloodstream. It can end up almost anywhere, such as the kidneys, pancreas, thyroid glands, sexual glands, and salivary glands. Transmission of mumps. The mumps is most commonly spread through person to person via respiratory droplets. Sneezing, coughing, and kissing are just some of the ways to catch the mumps virus. Affected items such as soft drink cans, eating utensils, and can also be contaminated with the virus, which may spread to others if the items are shared. Less frequently, the respiratory droplets may land on sheets, pillows, or clothing and then be transmitted via hand-to-mouth contact after touching such items. The incubation period from exposure to the virus and onset of symptoms is approximately 14 to 18 days. Diagnosis of mumps. Mumps is commonly diagnosed by your symptoms and the enlarged type of glands that are enlarged in the body. However, some people take swabs from their mouth, cheek, and throat to obtain saliva, and then that's sent to a laboratory to confirm the diagnosis. Symptoms of mumps. Up to half of the people who get mumps either have very mild symptoms or no symptoms at all. Therefore, they do not know whether they're infected or not. The most common symptoms include fever, headaches, muscle aches, tiredness, loss of appetite, and swollen and tender salivary glands under the ears on one or both sides of the ear. Symptoms appear 16 to 18 days after infection, but this period can range from 12 to 25 days after infection. Complications. The most common complication is inflammation of the testicles in males who have reached puberty. Rarely persistent problems. Other complications include inflammation of the brain and/or tissue covering the brain and spinal cord, inflammation of the ovaries and/or breasts, and females who have reached puberty and deafness. What are the risk factors for contracting mumps? Age is one of the risk factors. The highest risk for contracting mumps is the children between ages 2 to 12 years of age. Seasons is another risk factor because mumps most often occurs during winter and spring. Traveling to high-risk regions of the world, Africa and Southeast Asia, these areas have very low rates of vaccination. Weakening the immune system, either due to diseases, for example, HIV and AIDS or cancer, and medications such as oral steroids and chemotherapy. Long before 1956. Generally, individuals who were born before 1956 have contracted mumps infection in their childhood. However, if they did not, they are at risk for adults. Social effects of mumps. Due to isolation of the patient, we will not be able to make physical contact with others for 5 days. They will also not be able to resume school or work. Mumps prevention. The best way to prevent mumps is with the measles, mumps, and rubella vaccine, or MMR vaccine for short. The vaccine was licensed in 1967. This vaccine contains live but very weak viruses of the 3 diseases. After receiving the shot, the viruses cause a harmless infection in the body and helps the body learn how to attack the measles, mumps, and rubella virus if the person is exposed to it. As a result, it is unlikely that the person will get sick with any of these 3 diseases. Mumps treatment. Currently, there is no specific treatment for mumps, but ice or heat packs applied to the neck area and Tylenol can be used to relieve pain. Also, symptoms can be relieved with extra fluids, soft foods, and warm saltwater gargles. Antibiotics will not affect the mumps virus at all because this illness is viral. Aspirin should be given to the infected patient because they're also at risk of Rye syndrome. Mumps prognosis. After the illness, the patient has a long life immunity to mumps, and non-immune women who contract mumps during the first trimester of their pregnancy have an increased rate of miscarriage. In males, there is a small risk of sterility if the infection affects both testicles, but this is very rare. Fun facts. Mumps was one of the leading causes of hospitalization during World War I, and about 1 child in every 10 gets mumps gets meningitis. Another name for mumps is epidemic perioditis, and before mumps, the mumps vaccine was available, almost every child got mumps. Chris.
Okay. What is the amount of vaccine that should be given?
There should be 2 doses given. The first dose should be given when the child is 12 to 15 months old. And the second dose should be given when the child is 4 to 6 years old or 11 to 12 years old. William.
Are there any side effects to the vaccine?
Yes, but the most common side effect is just fever.
How long does fever generally last?
Sorry, I'm not sure. I'll have to get back to you on that. Josh.
Which is worse, the children getting mumps or adults getting mumps? Which is worse?
The adults, because the disease is more serious and they have a higher risk of getting complications. Gail.
Why won't the antibiotics affect the disease again?
Because antibiotics are directly targeted to bacterial infections or viruses. Data.
How long will it take to recover from this disease?
It will take about 7 to 10 days. Maya. That's Maya.
Are there like any long-term effects? No.
Yes, you could have long-term health problems.
What are
Paralysis is one. Ashton.
You mentioned that Dr. Johnson, can you explain what that was?
Dr. Johnson was Dr. Ernst Goodpasture's colleague, and he helped him with the experiment they conducted. Drake.
How much does the vaccine cost?
Sorry, what was that?
How much does the vaccine cost?
I am not sure, but I will have to go back to you on that. Lexi.
Why is the effects only with ages 2 to 12 required in this common?
Because this disease is actually a childhood infection, so it's like it mainly happens in children. So.
Gracias.